Nothing. After the trust.
Yeah.
जो सामने है ना हमें वो देख प्रेजेंट में क्या चल रहा है वो देख आप चुप रहो जाओ अपना ऑफिस मैं भी ना वो करा दी क्या बोल रहा है विशाल होने कुछ बोल रहा है वो बोलते तो सीधा है ही नहीं लोग
हाँ सर.
नाही आहे ना उसमें मंजुषा मैडम का ये हँडल्स उचलून घ्या.
हो 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 yes.
What people is
Good evening, sir.
Manjusha ma'am, you are unmute. You can unmute yourself and can start the meeting.
Hello.
Yes, ma'am.
Good evening, sir. Can we hear
Good
me?
evening. Yeah.
Okay. And I'm clear, sir.
Sorry, ma'am? Yes, all done, all clear. You can start.
Good evening, all the participants. This is Dr. Manju Chitte from Pune. I welcome everyone on behalf of IIAS. We are starting our session today. Today we have in between us the great speaker who is a legendary in the field of Ayurveda Orthopedic. His name is Dr. Swapnil Ravande, sir. Today he will be enlightening us orthopedics. So let's introduce him. He has completed his BMS from MEHS. Sir has also completed his MSc in Sports Science from Pune. Apart from this, he has done many fellowship and master certificates, some diploma certifications from various countries like DOMP, that is Diploma in Osteopathic Manual Practice from Japan. He has done his fellowship in sports rehabilitation from Hyderabad. He has also done his mastery in manual therapy from USA. He has done his certification in orthopedic manual therapy from UK. Also, for pain management, there are few certifications in which he has done certain certifications in emotional liberation breathing from Australia. He is also an NLP master practitioner and a life coach. Dr. Swapnil Ravande, sir, he is the founder and the managing director of Ayurprabha Multispeciality Ayurveda Hospital, which is located at Akola. He is also an honorable medical officer of Krida Prabodhini Akola. He is the president of Ayurprabha Foundation from Akola. He has received many awards. To name few of them, he has received an Achievers Award, Excellence in Healthcare, Puraskar in 2022. He has been also nominated for Lokmat Excellence in Healthcare in 2021. Sir has developed many skills from various countries, and by gaining the knowledge he tried to integrate this therapies in his, and during the integration he has learned so many things. He has invented so many things which he'll be sharing today with us, because when he when he had put all this thing together, it gave patient better relief. And today we can see every second patient is suffering from pain, stress, or any type of sport injury. So let's learn from him. Let's listen to him. How was his journey, and how he practicing Ayurveda orthopedics? That too, completely clinical view. Please
Thank
enlighten
you.
us.
Yes. Thank you very much, ma'am, for such a nice introduction. So I personally don't find myself as a legend. I will be a legend only if more practitioners I can empower with the specialty practice in Ayurveda, because we as Ayurveda practitioner are continuously suffering from a syndrome which is called the number two syndrome. So in the society, in every aspect, we are labeled as a number two or the alternative therapist, and I want to bring my each and every friend and colleague of Ayurveda fraternity as a number one in his or her field. I always motivate, or I always promote all the children, all the fellow newly graduated doctors come to me. I always speak with them. I always tell them that choose a specialty and make that specialty uh, as your whole life, and that will give you the tag of number one in your own field. So friends, not taking much of your time, we'll come to the point. As Manjusha ma'am said that I do practice the specialty practice, and I call myself as a Ayurveda consultant with special interest in pain, stress, and sport injury management. And I'm exclusively practicing in pain, stress, and sport injury management. There are lots of people in nowadays coming with who are practicing as a specialist, who are specialists in infertility, who are specialists in gastrointestinal issues, who are specialization in the skin issues, who are specialization in the karmas vadi, which are specialization into the lifestyle disorders. And this is a bright future of our fraternity. So friend, here I am promoting, I am here with you with the one of such example, my Guru Dr. Ramdas Awad give me this vision to become a specialist, and I choose that way. That I will be a specialized doctor, I will be a number one doctor in my town, I will be a number one doctor in my state with this specialty, with the special interest in pain, stress, and sport injury management. Till now, most of you may be practicing Ayurveda practice within the pain management, but I found the people who are struggling after doing lots of things like doing the classical Vatrok Chikitsa, the classical Panchakarmas, Upakarmas, and the modified upakarmas like Vidya Agni and the Agni and Agni Karma and the Vidya Karma. Also, some have developed their own skills of pain management. But what I seen today, I want to share with all of you in the form of a slide. A very interesting and the most. So here is my intro, which you have already gone through with the beautiful voice of Dr. Manju Chitte. So this is that slide. So I think that people, the Ayurveda doctors and Ayurveda acharyas are speaking lots of about the techniques of the pain management. Like some are speaking about the cupping, some are speaking about the osteopathy, some are speaking about chiropractic, some are speaking about Agni Karma, Vidya Agni Karma, or the Vidhan Karma. But what I call it is a diagnosing and the treatment elephant. So we all are experiencing, watching with our senses the each part, as the we all know the story of that six blind and elephant. So everybody is stuck up with some or the other reason. But what I call it, why I called it as an elephant? Because if somebody comes to you with a osteoarthritis of the knee joint, so we called it as a Janugat Sandhi. But and we start examining that is it a Niram, is it a Niram Vat, it is a or it is a Samvat, or again then the what are the Lakshana, and then we start treating with if there is a Niram Vat, then we start with the Janubasti, Shashtik Shalipinda Swet, some are doing the Dhara, Lepan. And then if the patient is not getting result or the patient is in a severe condition, then we try Vedan Karma, Agni Karma, Rakta Mokshan. But still, out of doing all these things, all this stuff, still some patient are coming again and again with the same complaint, and they are telling डॉक्टर साहब पंचकर्मा किया था, जब तक पंचकर्मा किया था बहुत अच्छा लगा, लेकिन जब से पंचकर्मा हो गया वापस पेन शुरू हो गया. आपने अग्निकर्मा किया था पिछली बार अच्छा लगा, लेकिन वापस पेन शुरू हो गया या दूसरी जगह शिफ्ट हो गया. So I found the common mistake or the common lacuna in this particular style of diagnosing is that we don't understand that there is a dhatu also. There are as if we see only to the Janu Sandhi, then the Janu Sandhi is a marma also. A Janu Sandhi is also having the Sapta Dhatu, 6 out of 7 dhatus. Then it is also having the Kapha Sthanam. It is also having the upasthis, the upadhatus. So what exactly is the reason for the pain? First we have to find that, and if we do find that, then we have the different tools. If we have the different tools, then we can tackle it with the differently. For example, बहुत ज़्यादा पेन है, बहुत सीवियर पेन है, आपने अग्निकर्मा कर दिया, ठीक है, पेशेंट को रिलीफ मिल गया, लेकिन then you have to think it is the osteoarthritis. There is the what is the osteoarthritis? Basically, osteo means bone and arthritis means the joint. Arthritis is the joint. The ortho means joint, osteo means bone, and itis means swelling. So it suggests that there is a swelling on the bones, or there is a swelling like structure on the bones. But if you go through, then you will find that there is not only swelling on the bones, but always the cartilages are involved, the ligaments are involved, the tendons are involved, also the bursas are involved, the fascia, myofascia, deep fascia, superfascia. Fascia has all these things are involved in that osteoarthritis. Also, we have to think about the degeneration. Also, we have to think about the misalignment of the particular joint, and for that we have to understand the mechanism of the injury also. So all that, when we will collectively see that elephant, then we can only see that it is an elephant, and all other organs like ear, trunk, legs, these are the different organs, and these are not the elephant as such. That this is, if you are seeing or if you are watching towards a patient with a osteoarthritis of the knee, you should think about cartilage, muscle, tendon, bones, ligaments, osteophyte, and you should have the different tools for taking care of all these anatomical elements which are present in the knee joint. So in this course, we are going to introduce this masterclass in Ayurveda orthopedics exclusively for the Ayurveda students and Ayurveda practitioners. In this masterclass of Ayurveda orthopedics, we are going to share, today I am not going to share the in-depth things. I am going to share that what this masterclass is going to actually will be happening. So this is just an example of a knee joint, that this knee joint is covering each and everything. It is having the fascia, it is having the tendons, it is having the ligaments, and we have to look after all these structures, and we have to take care of all these structures so that we can serve a complete plate of health, complete plate of happiness. So in this particular thing, that we have to diagnose that what is the significance of the pain in suprapatellar region, what is the significance in medial aspect of the pain, lateral aspect of the pain, intrapatellar, or into the medial aspect of the pain. So we have to understand. We are going to understand in this particular course, in the first module, that how to diagnose each and every joint of the body. This is just an example of the Janu Sandhi. This is just an example of the knee joint. So basically, which all structure I called, they come into the category of the soft tissues. That soft tissues contains the muscles, fascia, ligaments, tendons, and bones. Obviously bones, but bones are categorized into the hard tissue. So we cannot directly access to the hard tissue. So we can go through one by one through these soft tissues. If we strengthen, if we treat these soft tissues, then the pain segment or the structural changes which we are making into the soft tissues can support the hard tissue, that is the bone, that is the skeletal bone. Or so because our skeleton is supported by all these soft tissues, and if we take out the stress from these soft tissues, then we can give the good stability and mobility to our locomotor system, our bones. So the collective statement is that there should be, there ought to be, and we should be ready for the new perspective in the person-centered pain management. That is a call of action. That should be a call of action. That is a need of the time. That whenever you are speaking to your patient, your Rugna, then at that time you should be well versed with this, all this terminology. You should be well versed with the MRI reports, the CT reports, the X-ray reports which is patient is bringing or you are advising them. So for that purpose, you should develop a new perspective, new vision towards watching a pain, because you all know that we have all learned into the first year that pinde matir vinda, हर पेशेंट अलग है, हर रुग्ण अलग है, और इसके लिए हमें हर रुग्ण की तरफ देखने का नजरिया भी अलग होना चाहिए. सो एवरी ऑस्टियोआर्थराइटिक पेशेंट, एवरी लंबर पेशेंट, एवरी shoulder pain patient, every ankle joint patient have a different perspective, and we should have to develop, we need to develop that new perspective, and that is a call of action, and that call of action is this particular master class in pain management. So in this master class of Ayurveda Orthopedic, for the facial release, for the muscle relaxation, we are going to cover the myofascial release therapy. Myofascial release therapy is a type of gentle constant massage that release the tightness and pain throughout your myofascial tissues. We are going to see the cases, different kind of cases, and how to perform them, what should be the force, how deep you should go, how precise you should go, and how to diagnose. Definitely how to diagnose the which tissue or which soft tissue is involved in particular condition. So myofascial release can be done by the soft tissue mobilization, strain counter strain, trigger point release, instrument assisted soft tissue mobilization, dry cupping, and the gliding cupping methods. So these are some of the methods we are going to cover in this particular myofascial release topic of this Ayurveda Orthopedics master class. So I'm not going into deep, because for the sake of your knowledge, I will just tell you that what myofascial release therapy does. The myofascial therapy will, you have to locate the trigger point, you have to locate the trigger band of the particular muscle, particular affected part of particular joint. And that joint will be released with the help of this gentle applying pressure until the tension releases. And this can be achieved with these 4 kind of different techniques which we are going to cover in this course. Then after that, we are also going, these are some of the benefits for the myofascial release. That is the fibromyalgia. The fibromyalgia is found into the, is a very common sight into the old age patients. The fibromyalgia is a condition where there is that because of that the restriction range of motion you will find. Then myofascial release is a technique that can help you with the fibromyalgia condition, post-surgical condition, pelvic pain, scar tissue release, shoulder pain, abdominal surgeries, post-abdominal surgeries, postural dysfunction, and chronic headaches also can be released with this technique or this modality of the myofascial release. Then we are coming to the dry needling. Dry needling is a magical, very much appreciated treatment. It is nowadays trending right from local to global. We can say that dry needling is There are extensive researches are going on. Dry needling is the single modality. Some of the great physical therapists, some of the legend in the sports medicine are using and promoting more and more. So dry needling is basically used for the pain and movement issues associated with the myofascial trigger points and the muscle knots, which cannot be removed by just by doing the myofascial release. So whenever you got stuck in releasing the myofascial trigger points, you can use dry needling. Then with this technique, we insert the needles into a near trigger point, into the trigger point or near to the trigger point, and the structure related to the biomechanical facilitation of the range of motion. For example, a patient comes to you and complaining that he is not able to elevate, or he is not able to raise his hand above 90 degree. So there are most of the chances that his infraspinatus muscle or the supraspinatus muscle, or sometimes the rhomboid muscles had got spasm or got some or the other injury. So in this particular condition, dry needling will help you, and the patient will immediately release the obstruction into elevating the hand or raising the hand. It's late, so I'm going a little bit faster, but somebody please let me know, because there I am showing some of the message on my PC. That is the PPT clear? Are you able to see the PPT clear? Please somebody put a message into the chat box. Yes, thank you, ma'am. Thank you very much. Okay, then the needles, what actually the dry needles do when it is inserted into your soft tissue or into your body, the needles stimulate your muscles, which cause them to contract or twitch. What happens when the muscle or that particular structure got contract or got a twitch? That releases the spasm into that muscle. Also, that releases the freeze or the frozen fascia, which is covering the myofascia and also the superficia. So that got releases and the range of motion will be restored. Okay, this also helps in relieving the pain and to improve the range of motion. It is also do one more thing. It also stimulates your nociceptors and mechanoreceptors, which in research give the message to your subconscious mind, your immune system, that there is something wrong at this particular junction, and all your healing energy, all your healing chemicals will directed to that particular joint, and it will also, so dry needling will also help in managing your immune system. It also interferes into the pain gate mechanism. Pain gate mechanism we are going to learn in this particular course, in might be into first or second module. So in that particular pain gate mechanism, we are going to understand how pain is felt. If you got hurt, or if a needle is pricked to your particular part of your body, then you feel that pricking sensation or that pain. So the mechanism in the body which tells you that there is something wrong, or that the mechanism with which help you got a pain is called a pain gate mechanism, and that pain gate mechanism is also interfered or can be corrected with the help of dry needling. Sorry, these are the pictorial presentation of the dry needling. Some of the people ask me that what is the basic difference between the Vedhan Karma and the dry needling. So the basic difference between the Vedhan Karma and the dry needling you can see on the picture on the left side. That in the Vedhan Karma we use the 26 number needle, which is around half of the inch long. So it goes only at up to the dermis or dermis level, or the superficial skin only. Or sometimes if the patient is thin, we can reach up to the subcutaneous tissues only, but we can't enter with this 26 number or the 26 bore needle to the muscle level, or although we can reach to the muscle, but we can go up to the superficial layer of the muscle only. We can't go deep into the muscle, but with the help of dry needling we can go deep into the muscle, but for the dry needling, you need to understand the basic principles of the dry needling. You need to know that basic principles of the angles of the needling, in which angle you are going to put. So this all we are going to cover into this master class. So what are the benefits of the dry needling? Then when dry needling is applied to an affected muscle or a trigger point, it can decrease the muscle tightness, increase the blood flow, and reduce the pain. That's what I already explained into the earlier slide. Then patients often report the tremendous immediate relief into the pain. Sometimes a single needle can relieve a chronic pain of 4-6 months back. Also, dry needling is a safe technique. Most of the people are afraid about the needles. Most of the Ayurveda acharyas and some of our participants have also asked us that, sir, when you are teaching online, can we understand the dry needling? Can we do it directly into our clinic? So can we understand the how to apply dry needles just by learning online? So I am assuring you that definitely after doing this class online, you are directly going to apply the dry needles into your clinics, because we are working on the basics. I'm just not telling you like that this is a muscle and you have to put the dry needle here and you will get the result. No, we are going to see how the needle should be deep, what should be the angle for which muscles, which part, in which angle you should insert the needle. So we are going to see each and every part of this particular topic of dry needling. And yes, there are no obvious side effects of the dry needling. Even if the dry needle touches your nerve or the nerve fiber, it is not going to make any harm. There will be slight side effects. There may be a giddiness for some time. There may be a numbness for some time, but it can be recovered. There is absolutely safe practice is the dry needling. So it may help in treating many musculoskeletal conditions like shoulder pain, rotator cuff, bicep tendonitis, iliotibial band syndrome, Achilles tendons, low back pain, and many more. We all are going to see all these conditions in our course, organ by organ, joint by joint. Then osteopathic articulations are something which are different from the chiropractic and classical osteopathy treatment. So osteopathic articulations are the particular joint movements which you can give to the patient if you, when in a pain. Also, you can use these osteopathic articulation techniques to improve the posture of the patient, to improve the particular range of motion of the patient. Just in brief, we will see that osteopathic articulations refer to the mobilization and manipulation of the joints, although the process achieves so much more than it is implied by the statement. Though, in short, the statement is saying that the articulation and mobilization techniques are the techniques which are called as the osteopathic techniques, but they can help much more than just mobilization and manipulation. They are going to secrete even though in RA patient, where in rheumatoid arthritis patient, when you got the very less modalities to be done, you can use the osteopathic articulations. It can be used to treat wide range of applications, including musculoskeletal pain, hypertonic, osteoarthritic changes, or decreased range of motion. Some in the old age patient who are above 70 years, above 75 years, it is difficult to ask for the exercise. It is difficult to ask them to do the yogasan and all that things. But in that patient, you can definitely help out with this osteopathic articulation. We are going to see each and every joint in regards of osteopathic articulations. Then osteopathic articulations can restore movement, decrease the pain to your affected joints. Also low key manipulation to the problem zone, working within your pain range. So I will just not read, I will just tell you. For example, just see to that if a patient comes to you with this particular finger, and he is telling that it has got very stiff and I am unable to move this finger. So you can give the slight movement within the range of motion of where the patient can bear the pain, where a patient can tolerate the pain. At that moment, you start with the osteopathic articulation and you will find that the movement is gradually increased, the range of motion is gradually increasing. So this kind of miraculous, this kind of tremendous dramatic results you can produce with the osteopathic articulations into the tough patient to deal with. So for your understanding, I am just showing you one case of osteopathic articulation, that how you can benefit the patient with this osteopathic articulation. In the left X-ray, you can see that there is a loss of height and also there is a disruption of anterior alignment. So here the patient is around 70 years old. I cannot do the chiropractic correction to this patient. Also, the patient is very much, you can see that in the Vruddha, so we can't do rigorous panchakarma for the patient. So in this patient particular, I am doing the osteopathic articulation for the D12 and L1 vertebra. So in this video, you can see that I am articulating that particular joint. So it is going to release the thoracolumbar tightness, the thoracolumbar fascia, it is going to get mobilized, and we are going to learn each and every type of particular this osteopathic articulation techniques. So also along with this, we are going to see the different kinds of cupping, because cupping is also a very good technique or very good modality to practice with, and it has got the many phases. You may have practicing some of them, and I am going to add some of the knowledge around about the cupping. So different types of cupping are there, as we have already seen into the myofascial release, that gliding technique and dry cupping. So dry cupping, weight cupping, fire cupping, and dynamic cupping. Some of the you may have heard about the dry cupping, that we have also discuss about it, that to where the cup is directly fixed to a particular joint without any lubrication or without any of the other modality. Direct cupping is also called as the dry cupping, because we apply it on the dry surface. The wet cupping is the cupping where we do the prachan karma, we do give the micro cuts, and then we attach the cup. That you can see into the right upper image. In the right lower image, you can see the fire cups. The fire cupping is the cupping. It is just like applying the ghati yantra. It is just like applying the alabu. So here we create the vacuum into the glass cups and we attach it. Just you can see into the right lower image. And into the left side video, I am going to play it now. I am doing the dynamic cupping. So here he is a professional athlete with the hamstring stretch. So here I am just demonstrating you that how I am helping that hamstring stretch release with the help of cupping and giving the dynamic movement. So this is called the dynamic cupping, and we are going to see for each and every joint how to apply and how to give the mobilization to release each and every muscle. So this is what we are going to cover about cupping. Then the potential benefits of the cupping therapy are: it reduces pain and inflammation, decreases muscle tightness, improves blood flow, increase range of motion, also gives benefit of ghati yantra, rakta mokshan, and mardan. So you can associate cupping along with your classical Ayurvedic upakarma and panchakarmas. Then I am also going to share some of the innovative panchakarmas. I have not invented, but I have innovated lots of things which can be added to the practice with the help of modern technologies, modern medicine, not modern medicine actually, with the help of modern technologies and with the basic principles of classical Ayurveda. Just like into the first video, here you can see that we are doing the simple Janubasti, but we are giving the laser light. The blue laser light we are giving, so that already we are using the penetration of this particular blue light insert deep up to the meniscus. So as you all know that we are giving the Avgah Sweda of Janubasti. so that the lubrication, so that the synovial fluid, so that the mobility of the joint will restore. And also in association with that, we are also giving the laser light, which is penetrating the effect of that oil, the prabha of that oil, deep up to the meniscuses and deep up to the joint spaces, the synovial fluid. Into the next, into right image, you can see that there is a below knee traction applied. This was just for the demonstration, hence the oil was not present, but you can imagine that we can pour that oil here and we have attached here the traction. So it is called as the below knee traction we have given. It is given around 7 to 8 kgs as the patient was old age. So what it is doing, the traction is doing two things. What happens when there is excessive degeneration? If you can see this model in my hand, so when there is excessive degeneration, when there is excessive the space between the joint become reduced, then also there is the internal or external rotation happens, and that disturbs the normal alignment of the knee joint. And what happens when you give this traction, that normal alignment is achieved also, and also the structures which got freeze there, which got fibrous there, also got released. But one thing you have to remember, that you have to do this traction janu basti after doing 2-3 normal bastis, because till then you have to make the joints more elastic, more flexible. If you don't do that and if you directly attach the traction janavasti, then it is going to hurt the internal soft tissues, internal muscle fibers, internal ligaments fibers, because in the old age they become already fibrous and brittle. So you have to take the caution that you have to start the traction janavasti after 2-3 sessions of the normal janavasti. So these are the basic. There are then other innovative panchakarma and upakarma we are going to learn, or we are going to discuss in this, like the ultrasound massage, the ultrasound facial release, and all that things innovative, which I am practicing at my place. I am going to share with you. Then along with, we are also covering the functional anatomy, the diagnosis, the clinical, radiological and pathological of each joint, each pathological conditions, each pain conditions we are going to discuss in this particular manner, that clinical, radiological and pathological diagnosis we are going to see. We are also covering a topic of Marma Chikitsa, that how Marma Chikitsa can help you or can be established as a boon to your practice. Also Bandha Chikitsa, in bandaging, the therapeutic taping, the taping of the kinesiology taping, the heart taping, also the classical bandha like Shulhar bandha, Shothar bandha, or how can you help the patients with the undisplaced fracture. We are going to cover in this particular, or if the swelling, for the posture correction, what you can do with the bandha. Also, we are going to discuss the utility of our classical drugs, classical modalities of Agni Karma and Vedan Karma. One more thing, the dry needling I am telling about, you can use dry needling as a Gambhir Vedan Karma, a Masgat Vedan Karma, Pichagat Vedan Karma. You can use that Kandaragat Vedan Karma, even though you can do Vedan Karma and with the Karma hand in hand. Okay, so along with these modern modalities of the manual therapies, we are also going to discuss our classical Ayurveda and how to correlate, how to develop the protocols for particular patients we are going to see. Also, we will discuss here the drug of choice, as in our Ayurveda field, most of the people practice differently. Like some are practicing in Panchabhautik, some are practicing only Kashaya, some are practicing using only Kashta Aushadhi, some are only using proprietary medicines. So the drug of choice is up to you, but definitely I am going to share the common drugs or the common drug formulations which I use in my practice, which are helpful, which can, and with the reasoning. So we can develop a protocol, we can set up a protocol for different kind of patients, and we will have different kind of weapons, different kind of boons in our back, so that one or the other boon got failed, we can take out a one new or a different. And also here we are going to learn the principles of all the modalities, just not showing that do like this and do like this and the patient will get care. No, we are going to see basic principles. What is the reasoning behind selecting a particular modality? What is the reason behind diagnosing a particular thing? And what protocol we should make for our clinic and for our standard operating procedures. Then these are all I have sum up for you, that you will learn all these 14 things in this particular course of 6-month online masterclass in pain management. So functional anatomy, diagnosis, marma chikitsa, bandha, Agni and Vedan karma, cupping, innovative panchakarma, posture correction, myofascial release, Gambhir Vedan, that is dry needling, trigger point therapy, osteopathic articulation of the spine, instrument assisted soft tissue mobilization, muscle energy technique, and experience of exclusively 10 years of pain management. So this is a complete branch of learning we are coming to you in this masterclass in Ayurveda Orthopedics. It is a 6-month comprehensive orthopedic course for Ayurveda doctors. And this is our last call today, as we have already scheduled this lecture. Our admissions are already packed. We have already, I think that near to the mark of our intake capacity. But as we have committed to our delegates, we have committed to our all the participants in the group that we are going to conduct this course. So this is the complete module, that each module we are going to learn. Into the first 6 module, we are going to see the different principles of these modalities, from Ayurveda to modern, from module 7 we are going to see organ by organ, joint by joint, just like cervical spine, thoracic spine, lumbar spine, pelvic girdle, shoulder joints, elbow. Each joint we are going to cover differently, so that it will be very easy for you to understand that what to do in which condition of the particular joint. Because so we have designed this course that it will be like a ready reckoner to you. It will just like be a ready reckoner. It will be a ready reference course for you. If a patient will come with you, come to you with a shoulder pain, then you will be very clear that what I have to do, what is the diagnosis, what is the treatment, and how I will rehabilitate. So in this particular format, we have designed also, apart from this, some of the psychosomatic disorders like rheumatism, ankylosing spondylosis, and other special conditions we are going to discuss in this particular course. And at the end, we are also going to share the muscle energy techniques, how to rehab, also the diet and nutrition, how to manage a diet and nutrition, how to manage diet formulations for the different kind of cases. Then in the osteoarthritis, what should be the diet, in what dietary changes you can advise to the patient. And also yoga, and not actually yoga, it should be the muscle energy techniques, but definitely we are going to share some of the yoga techniques also. So I think that Dr. Manju had to add something.
Sir, I want to ask you one thing.
Yes, ma'am.
Will you provide the recording if I won't be able to attend the live lecture, or in case I want to hear you again?
Ma'am, these all lectures are going to be on the app of IIAS. So basically, you have to download that app, and that app will give you the recording access up to 1 year, or for more than that also, because our course is also of 6 months, and after completion of this course, you will have that recording up to 1 year or more than that.
Thank you, sir. There are a few more questions, sir.
So you can
are we going
ask,
to get
yes,
the PPTs or some notes for this?
If there are the PPTs, if there are the notes which I am going to share, you will definitely get it. I will.
Thank you,
There
sir.
are
That
no,
will help
because
us.
because one more thing I want to be very clear that even if I am not an academician, I am a hardcore practitioner. So it is not possible me for to take out the notes and to share with you. But definitely I will share you with some of the good books. Also the PPTs which I am going to share for the purpose of learning or purpose of teaching, that I am going to share definitely into our private WhatsApp group.
Sir, I am Dr. Harshavardhan, Professor, SV Ayurvedic Medical College, Tirupati.
Yeah, sir, may I have 2 minutes, please? I will just wind up in 2 minutes
Okay.
and come back to all the queries I am addressing. Okay, so just 2 slides.
Okay.
So this, yeah. So about me, I have already discussed my intro. So all this knowledge I have gathered from all these great teachers, great leaders in the pain management all over the world, as Dr. Manjusha Chitte had already said. Because it is already too late, so I am not going to introduce each one of them, but some of them I will teach. This is Dr. Jay Amata. Jay Amata is the principal and director of Japan Health Association. He is also the chief consultant, there they call the professor or the chief instructor, but in our term he is the dean of our college, that is Palms Osteopathic College, from where I completed my diploma in osteopathic manipulative practice from Japan. Then Gils Geyer, he is the trainer and world-renowned trainer. He has visited India lots of time. He is also a trainer to all the physios in the European leagues. This is Tom Mayer. This is Tom Mayer. He is the innovator of the where we can reset our autonomic nervous system. So, he was also the innovator of the how to reset the autonomic nervous system, which we will cover in our course at some extent. I can't share everything, but definitely I am going to share the key points of that. He is Jad Wehebe. He is a world-renowned sports psychologist from where I have done in his great leadership, I have done the ELB, and that is emotional liberation breathing and induced stress management. So they go on. There are, but as we are running out of time, we will move. So the thing is that we are. I have spent more than 20 lakh rupees in last 8 years for all these. So if somebody asks me that how, for what amount you will teach these all things, so I cannot claim any amount, or I cannot say. But as I have cleared my vision earlier, that I want to empower my colleagues. We are offering at the cost of 10% of total invested cost, that is only 20,000 rupees. But as we have already committed that this lecture is going to happen, and in every lecture we are going to give a bonus to our participants. Hence, for next 24 hours only, and here the PPT is also here. It is not option now to pay the 3,000 and 15,000 rather, because the class is starting from 8th July already, from the coming Monday. So in next 24 hours, if you pay the 15,000, the fees to this course will be 15,000. After that, it is going to be, once the class started, the fees will be 20,000. Okay, and the mega bonus which I am offering from my side, that is the 2 days offline workshop for hands-on training, that is worth 15,000, absolutely free. Absolutely free with this course. So you are losing no money. There is a win-win situation. Although you are going to learn each and every aspect of the pain management in this 6 months, after that you will also be able to join this 2 days offline workshop, where I am personally going to clear your all the queries. We are going to take the hands-on training. I am personally going to teach you, correct you your techniques and methods. So this is all from my side. Thank you very much for listening me so calmly. Your dedication towards perfection, your perfection will bring you the performance, and your performance, your performance will bring you the success. And we will champion. We are the world champions now in the cricket, and we will be the champion of pain management in India, not in India, in across the globe. Thank you very much, all beautiful peoples. So for more details, you can take a screenshot of this particular slide. You can contact Dr. Manjusha or Dr. Lalit sir. And these are the details. Now I am coming to the query session, so you can unmute yourself and ask the question. Sir, you are asking some question, please. You can unmute yourself now and ask the question.
Okay, sir. Very nice presentation. I am Dr. Harshavardhan, Professor, SV Ayurvedic Medical College, Tirupati.
Oh, sir, thank you very much. It was
Panchakarma
so graceful
department.
to you.
I am a professor. Sir, so many cases as per ortho, after leaving the orthopedicians, so they are coming to us,
Yes,
especially arthritis and several conditions.
Yes, sir.
Along with Panchakarma, we are practicing physiotherapy.
Yes, sir.
So here, up to some extent, we are dealing where the disability and all the things, especially in Pakshagata or in even in so many ortho conditions. But by applying your methodology, how far the percentage we are going to deal?
Sir, I will just share you one thing. In a quick start, I have in the last lecture I have shared that case. A case of a 42-year-old lady came to me with a severe knee joint pain. She had been up to the three of the orthopedic surgeons, three of the topmost orthopedic surgeons in my city, and also she had visited 7 to 8 visits to a physiotherapist.
Okay, sir.
When the patient comes to me, I examine her and ask her that what are your prime symptoms. So she told me that I got afraid even if I saw the staircase. I can't climb a single stair because there is a range of motion. There is a severe pain whenever I flex my knee. Already investigations were done. Already the MRI was already done, and in MRI it was suggesting that there is a meniscus tear. But if we understand micro in the macro way and into the Ayurvedic point of view, if you can see that there is no role of particular meniscus tear into the range of motion. It may be painful while walking, it may be painful while climbing, but there should not be that much impact on range of motion. But the patient was having the issue with range of motion. I just asked her that how is the pain? So she told me that I am feeling that there is a massive swelling on my thigh. So it was like tod in our Ayurveda. So it was a show. It was a tod. So with which methodology I have shared now, I have done the ISTM, that is instrument assisted soft tissue mobilization. What happens that swelling or that extracellular fluid which has got accumulated and which is obstructing the range of motion got dispersed, and the patient immediately into the 15 minutes start walking and start climbing the stair without pain. So this is what I want to just share, that we should have a broad spectrum vision, that what is the actual element which is causing the pain or which is affecting the range of motion. So
that's what, sir, because articular and non-articular, because if it is meniscus in the articular position in the joint, within the joint, it will be secured. Most of the tendon tears, the movement was there, but if it is abduction, at that moment he has not. Suppose if you see about supraspinatus tendon tear, he cannot abduct and lift the hand. Because little movement, it was restored. Yeah. But the back movements was not there. That's why.
No, that was an example which I have given, sir. We have to, when there is a case, we have to go through it in depth. I just have got an example that most of the people, what our colleagues do, they do the Ansavasti, they do the different Vedan
Yes,
Karma or Agni Karma at the shoulder, but the issue is in the supraspinal. That's what I was actually making point.
yes.
So we have to understand the every aspect of movement and pain. That's what actually I want to say.
That's what, sir. Because even in the modern, they are advising only rest, and after mobilization of 1 or 2 months, third or fourth month, they are allowing for physio or any
Sir, if
rehabilitation.
you are already a laureate, you are already a respected professor. So, sir, nowadays there are some research articles which are showing that the rest or the bed rest is the worst thing you can advise to your patient.
Yes, sir. It will be rigid like anything. That's what, sir.
Definitely.
The preserved movements,
So
and I am advising some of the tear condition applying just Burvena and light movements we have to do, and along with physio we are
that
doing.
is what osteopathic articulation. Just osteopathic articulation has got some of the principles.
This is very new technique, sir, which is adaptability,
Yeah.
and we required some of the workshops in international conferences like that, and thereby everyone should aware, especially those who are in Panchakarma sector, already always associated with physiotherapy and
Definitely, sir.
doing.
I am already a promoter of the integration because we have to become the integration. We have to become the modern Vaidyas.
Yes, sir. Sir, meniscal tear also you are getting the same result, sir.
Sir, meniscal
Meniscal.
tear, I am not sure that meniscal tear will got repair or not, to be
Okay.
very frank. But if we restore all other structures,
Okay.
like the ligaments, tendons, and other
The
structures which are
ACL tears
supporting,
like that areas because most of the young people also is getting right now all the tears.
so that's what I am saying, sir. If we can able to postpone his surgery for next 5 to 10 years, it will be
Okay.
also great help to them. Because if you do the meniscal tear repairs or the meniscal tear surgeries into young age, they are definitely bound to land up into the osteoarthritic conditions in their 40s.
Okay. Okay. Sir, one more doubt regarding lumbar area. The disc space narrowing, sir.
Yeah.
Almost all below 7 mm or 5 to 6 mm cases. So, shall we take up or we are because there
So
the
I will
collapse is
share
more.
I will share my number because this is not because what I personally do. I take that cases and I treat also because I am actually practicing in osteopathy also. So we do use the different techniques for that. But definitely in Ayurveda Panchakarma also we can take the cases. Just we have to be vigilant about the neurological deficient that we should be vigilant about that there should be the no nerve injury.
Okay. Okay.
If the patient is clinically stable and he is what we can say that responding to the treatment, then we can definitely take. But if we find that there is a gallbladder or bowel bladder
Bladder
involvement,
bowel incontinence will be there
yeah,
if
yeah,
it is.
then we should not take the risk. That's what I think because the surgery is itself suggested by the Sushruta.
Yes, sir.
So
Yes,
we cannot
definitely.
deny the surgery also because that is the Shastra
Yes, sir.
Shabda.
Yes, sir. That acuteness, if all Ayurvedic doctors know, so there is no issue and no problem.
Yeah.
Yes, sir. Very nice presentation and explanation, sir. Thank you very
Thank you,
much.
sir. So it was
We'll
very
meet personally.
nice to listen.
Yes.
Thank you, sir. Yes. Any other questions, friends? Any other questions? Any other query regarding workshop, regarding anything else?
Sir, one more doubt, sir, regarding
Yeah.
right now, almost all Indian women or men, they are getting bone density very less. If we gone for any of the X-ray or BMD
Yeah,
done
sir, definitely.
studies,
But it is a
uh,
physiological thing, sir. BMD.
That's what, sir.
Yeah.
For that, what best therapies can be advised for?
So there is no therapy, sir, which can be helped with the
Not
bone
only
density.
therapy, sir. The things.
Tiktakshir Basti, sir.
Tiktakshir Vasti already we are giving.
Yeah.
But how far we have to prevent the fractures? Because right
Sir,
now,
one more thing,
youngsters,
which we are going to cover in
if
this
they
class.
fall, whether it's the tier,
Yeah.
especially
Yeah.
40, 50s,
Yeah,
and even our so many faculty also, they are falling, and whether it's
getting
bent or
fractures.
tier.
No, sir, the one more thing, the best way to prevent, one thing is that we have to do the nutrition, we have to provide the nutrition in the form of oral medication, ahara, and also the Tiktakshir Basti. But one thing, there is the ahar rasayan, and that ahar which ahar we can give is the correct postures.
Yes, sir.
So in this particular course, we are also going to cover the postural program, that how we should prescribe the posture to the patient, that how should we advise them that how to sit, how to walk, how to do their daily routines, how to ride a bike, how to drive a car,
Yes, sir.
and how to walk, how to get up from bed. So, and how should be your ideal posture, so that
Yes, sir.
there will be a minimum pressure on your skeleton.
Yes, sir. Yes, sir.
So that will also help in preventing these kind of fractures and the injuries happening out of low bone density.
Yes, sir. Definitely, sir.
Yes.
Thank you
Yes.
very much, sir.
Yes, sir. So I will share my number into chat box. Please, if possible,
I will note it.
ping me.
Yeah. If any of the CMS will invite you, sir, if it is possible.
Thank you, sir. It will be my
Because
great pleasure.
last December we have conducted, last even January.
Sir, it will be my pleasure.
Yes, sir, definitely.
For everyone, I am pasting my number. If you have got the query, you can just WhatsApp me on this particular number.
Okay, sir.
Any other queries, friends? It's already 10. So if you have any query, you can put it into the chat box, or you can
Sir, I
unmute
just want to.
Yes, ma'am.
Yes, sir. I
You
just
can
want to
ask.
tell the participant that this offer which you have provided was only for 50 students. Okay.
Yeah.
And we have already completed 60 participants.
Oh,
So this time, since you have only for next 24 hours, and after 24 hours, the fees will be 20,000. And of course, we'll be
there will
giving.
be no participation in our offline course. Hello. Hello. Your voice is breaking, ma'am. So actually, this
open, right, sir?
Yeah. Yes, ma'am. So what basically your voice was breaking, so I will complete the madam's statement that I have the lecture was scheduled and I have declared about the discount of 50,000. So madam is telling that we have committed this for only first 50 students, but as I have spoken, I am not going to take my words back. But if you are going to pay in next 24 hours, it will be only for next 24 hours. After that, the fees will be 20,000, and it will be difficult for us to cater you in the offline course, because we have the capacity of 50 people. Then it will be difficult for us to cater for the offline course, which I have already declared. Yes, Manjusha madam, you can complete. The voice was breaking, hence I have completed your sentence. For Dr. Lalit sir, if you are there, you can complete.
हाँ सर, आपने बोला उसी टाइप से हम करेंगे। किसी को और कुछ क्वेरीज है तो प्लीज आप पूछ सकते हैं।
Hello.
Yes, ma'am.
This is Dr. Sujata from Bangalore.
Yes, ma'am.
We have to pay in an installment or as altogether we have to pay
No,
15,000?
I think that the installment timeline has been over. So, but you can speak with Dr. Lalit or Dr. Manjusha. I will
Okay,
again
you
going
share
to
the
share.
number with us, no?
Yeah, yeah. I will
The
again
WhatsApp
share that
also.
slide. Yeah. This number
Okay,
I
I'll
am
take.
going.
Thank you, sir.
Yeah. Yeah. These are the numbers of the
These are the numbers.
organizers. You can take the screenshot of this.
Sure. Thank you.
So if there are any queries, if there are any questions, you can unmute yourself and ask. I will be there for next 1 or 2 minutes. And if there are no questions, we will conclude. Okay, friends. Wish you all a very good night and sweet dreams. See you soon on the next part of this. I think there are no questions. Thank you very much for this patience. Thank you.